For those battling addiction, the challenges may seem insurmountable, but recovery is possible. The Mental Health Association has a new residential treatment program known as GRIT. MHA's recovery coach Dallas Clark spoke with Carolee McGrath about the program and shares with us his story of addiction, perseverance, and how, as he puts it, iron sharpens iron.
As me being a recovery coach, I'm here to support others in their path for recovery, give them hope, encouragement. If they need to overcome some barriers, I'm here to help them overcome barriers, their life struggles.
Okay, and Kim, this is a new program that has been started, one of 26 programs in the state. Explain to us a little bit about what MHA is facilitating with the GRIT program.
Sure. So GRIT is one of 26 new residential rehabilitation services programs that are being funded through the Bureau of Substance Abuse Services around the state of Massachusetts. And so the program that Dallas is in, the GRIT program, is in Springfield. We will be opening up another program in Springfield, and then later this year we'll have another GRIT program that will open up in Holyoke.
Okay, and it also includes both components of substance abuse and those who are struggling with a mental health issue as well.
That's correct. So what makes these programs so unique, Carolee, is just that fact, and that's that individuals who have been in recovery pretty much up until this point have sought services in one location for substance use and then a second location for a mental health diagnosis. GRIT puts both of those services underneath one roof in one location so that people can recover both from a mental health diagnosis while also working on a substance use diagnosis as well. And so from the perspective of a program participant, it just makes it so much easier, as I'm sure Dallas can talk about as well, in that individuals have all the wraparound services, all the supports, all the programming they need from an educational perspective, all under one roof. So it's very convenient. And from a clinical perspective, for the clinicians who are focused on the mental health aspect of a program participant's needs, to also right then and there have right across the hall or at the desk right next door, have an opportunity to talk about what might be happening from a substance use perspective. And so from an efficiency of programming, it's just a terrific model.
Okay, and so Dallas, tell us a little bit about your story. I know you had a battle with addiction. Tell us about that.
Like that cliche, I became a product of my environment. First, I got involved in selling drugs, then became an alcoholic, and also using drugs. I did jail time, and I just wanted to change. I needed to change. In the beginning of my recovery, I had a recovery coach myself, along with a sponsor and a therapist, and going to groups, and I just wanted a different life. And when I first asked about the recovery coach aspect of me becoming a recovery coach, I had a mentor that told me, once you put on this suit, you can't take it off. So, I did the training for that, and I just wanted to give back. Like I said, I had a recovery coach, and I know how important to have a recovery coach in the beginning of recovery. I lost all hope for myself. I had people that believed in me before I believed in myself. So I want to give that back. I want to encourage others, give hope back to others that lost hope, and let them know that recovery is possible.
How old were you when you first started with a substance abuse?
I could say around 14. I got involved in the streets around 14.
And how long did that last?
I could say like 30 years. In and out of jail. I did a long jail time.
Did you ever think it was possible that here you are sitting today, as on the other side of this, as a recovery coach, that you would be the person, helping somebody out of, that struggle that you had for so many years?
Not exactly. I didn't even know I was a people person. Like I said, I had people that believed in me before I believed in myself. And I never thought I'd be here where I'm at today. And what I thought was normal to me, it's becoming abnormal. The way I was living was normal to me. I didn't see nothing else but the way I was living. But as somebody came into my life and showed me that there's a change, there's other, there's other things out in life.
You were made for more, right?
Yes.
I think the line that you just said, once you put this suit on, you can't take it off. That's a really powerful line. What did that mean to you at that time? Like, were you a little bit nervous? Like, am I sure I'm ready to do this?
I won't say nervous, but I knew what he was talking about. Is integrity. Like, you can't turn recovery off. Either you're gonna be in recovery or you're not. You can't turn it off. Recovery is a lifestyle. So every day I gotta wake up with a spiritual awakening and make it through this day, and I can't turn recovery off where I'm helping somebody else. The next, I'm being seen in the clubs and the bars. I got a true leader lead by example. And integrity is a big key for me.
I think his personal story must be so powerful with the people he's now helping in the programs, because it's one thing, for somebody, you can talk about their problems, this, that, and the other thing, but for him to say, look, I've been there. Right. I think that makes a difference.
It does. It makes a huge difference. And, we really do applaud the state for recognizing just how important the access to recovery coaches are for people who are in recovery. And so when you look at, an individual like Dallas, who is now working with other individuals who have been in a position where he was, who better to understand how you're feeling emotionally? Who better to understand, the grip that addiction can have on you? And, Dallas talks a lot. I've learned a lot from Dallas, in our time together. And, you learn a lot in that, you see people across the street who are doing what you used to do. And you can't be on that side of the street anymore. Now you have to be on this side of the street. And it's a huge change. It's not just enough to simply stop using drugs, but you change social circles. You change the way you talk. You change the way, your whole life changes. And Dallas, has been such a positive person in the GRIT program, to help the guys who are in the house really understand what he's been through. He understands what they've been through, and they're keeping eyes on each other.
Yes, definitely.
Right?
And that's what I like to use the word iron sharper iron, whereas it's helping me. I don't have all the answers. And just like everybody got to upgrade their iPhones, I got to upgrade my recovery. I'm still learning about myself. So by interacting and helping and sharing and giving back to others, it's helping me at the same time, helping me keep grounded, and helping me to learn, I could do better on this aspect, or something goes on in my life, I could reach out to others, because I still need support. And that's a big thing about in recovery, you have a support team. And I keep people around me. Same thing I was doing a year ago, I'm doing today. And I can't get complacent. I can't get uncomfortable. I got to stay uncomfortable. I got to stay challenged.
So I know the statewide numbers of opioid-related deaths are down, but there's still, quite a concern in cities like Springfield and Holyoke. So obviously this GRIT program is just so critical to help people in this area.
It is. It's GRIT is an incredibly unique program. Again, just as those other 25 residential rehabilitation services programs that are being brought online, because it's not enough anymore to just simply look at addiction from one perspective or the other, because it is usually both a mental health as well as a substance use issue or concern. And so the state of Massachusetts obviously is recognizing that and really wanting to put online more of these programs so that there is that strategic, intentional focus with individuals who need services from both the mental health as well as the substance use perspective. And embedding recovery coaches into those programs just makes a tremendous amount of sense, so that it's clinical, it's substance use, and just as importantly, it's lived experience.